What are the signs and symptoms of a blighted ovum? We are going to talk about the signs and symptoms of a blighted ovum, the signs and symptoms of an embryonic pregnancy. Remember, in our previous video, we talked about a blighted ovum, or also known as an embryonic pregnancy, and we said that this is when the pregnancy is growing but the gestational sac is not having a live embryo. Specifically, here we are talking about an empty gestational sac. A woman is pregnant, but inside the gestational sac, where the baby is, where the baby lies, there is no live embryo. So how can you tell that you have a blighted ovum? How can you tell that you are carrying an embryonic pregnancy? In today's video, we are talking about this, and without further ado, we shall go to the first sign and symptom. The first sign and symptom is that there is a positive HCG urine test. There is a positive HCG urine test, meaning that when the pregnancy is growing, when fertilization has taken place and the fertilized egg has traveled up to the uterine lining and it has attached or it has implanted onto the uterine wall, the pregnancy is going to show that it's growing. There will be a gestational sac with well-defined echogenic walls, and when you do an ultrasound scan, it will show that yes, there's a gestational sac. And the other thing is that there's what we call the decidual basilis, or where the placenta is going to form. So the placenta part, that placental part begins producing the HCG hormone. So we were talking about that part where the placenta is going to grow from. It's called the decidual basilis. So when you do an ultrasound scan, that part where the placenta grows from, that placental part specifically continues producing the HCG hormone. Remember, the HCG hormone, or the human chorionic gonadotropin hormone, it continues to be released. So whenever you do the pregnancy test, the urine pregnancy test, it will be positive. So the first sign of an embryonic pregnancy, or the first sign of a blighted ovum, is a positive urine pregnancy test. The main reason is that the hormone, HCG hormone, it continues to be released in the body despite a blighted ovum showing on an ultrasound scan. The next pregnancy sign, the next sign of a blighted ovum or an embryonic pregnancy is there will be sore and tender breasts. Your breasts will be sore and tender, meaning that these signs of pregnancy will still be shown. The main reason is that the hormones that are responsible for breast enlargement and preparation for like a pregnancy which was to happen, that is the hormones prolactin, continue to be released. So there will be sore and tender breast. Next pregnancy sign is that there will be cramp-like pain, and specifically this also is due to the implantation taking place. And lastly, there will be spotting. The main reason of spotting is that, remember, this is an early pregnancy, so as that gestational sac is implanting onto the uterine wall, it will continue causing little bleeding or spotting, also known as lacunae. So in summary, we have talked about the signs of a blighted ovum, and we have said that the first sign is there is little bleeding or spotting. Next sign is sore and tender breasts. Next sign is a positive pregnancy test, and lastly, cramp-like pains. Let me know if you have any questions down below in the comments. I will answer all your questions, and remember to hit the subscribe button for new videos we put out every day. Have yourself a fantastic and healthy day. Like, share this video with all our friends so that they can get to know about what we talk about here, women's health. Remember, I can answer all your questions in the comments. Ask me all your questions. Thanks for watching this video, and I hope you've learned about the signs of a blighted ovum. Have yourself a fantastic day, and may God bless us all. Bye-bye. Hello, welcome to our channel. I'm Gerard Massa, the health educator. On this channel, we talk about pregnancy related questions. We answer all your pregnancy related questions. We also do talk about conditions including fertility, infertility, endometriosis, endometritis, and also we do discuss issues regarding polycystic ovarian syndrome. Let me know if you have any questions, and welcome for today's lesson. You are most welcome, and stay with me today as we talk about today's topic. Welcome.